So the basis for this is health data governance in the age of AI was coming out of work that we've done in terms of evidence that we'd gathered in our status in a survey on digital health across the WHO European region, and of course, other research and information that went into a policy brief on health data governance, especially now in the age of AI. So why does health data governance matter? Well, 86% of member states have legislated patient access to personal health data, and another 73% of member states have allocated special funding for bolstering digital health. And of course, throughout the pandemic, which is at the back of our minds now, and we've realized how crucial data was to everything that we're doing and digitalization. And moving forward now, even more prudent that health data governance is crucial in supporting AI, because without strong, good quality data, we can't have proper AI systems. And it should know that countries should start to invest in national health data governance to improve the quality of care, to support the AI adoption, and of course, to garner public trust. And effective health data governance is essential for creating trusted digitally enabled health systems that deliver high quality, equitable care to populations. And of course, this is being driven in many fields and factors. For example, the European health data space underlies all of this and is a very strong key component of that. However, there are some implementation challenges, and of course, we have solutions to those. And what are some of the implementation challenges in terms of health data governance? We have a lot of legacy systems and their potential privacy concerns. And of course, we have also found, as noted in the policy brief, in cases there are limited stakeholder input. So governments and policymakers and decision makers need to invest in infrastructure, they need to promote transparency, and of course, they need to build capacity across all of these aspects, and especially within health data governance, to have that strong underlying systems and governance mechanisms. And what's at stake with all of this with AI and healthcare? AI can transform healthcare, but only if it's built on trustworthy data. And there's risks of poor governance can cause bias, it can cause inequity, it could cause misdiagnosis, and it could cause misuse, among other things. So data must be representative, it must be ethically sourced, and must be protected. And of course, underpinning all of that is strong health data governance. And of course, any data and any implementation of AI should apply fair principles, findability, accessibility, interoperability of data to ensure that it speaks to, all your systems are talking to each other. And of course, it's reusable for safer, transparent AI development. And effective governance ensures that health data for AI is of high quality, it's representative, and of course, it avoids the bias. So coming out of that policy briefing, there were 4 urgent policy imperatives from the WHO. There's a need to strengthen governance frameworks to ensure legal, ethical, and secure data handling. There's a need to build national health data standards and to promote interoperability. Establish institutional mechanisms to coordinate your data sources and improve consistency in data collection, data management, data processing. And to engage all stakeholders, especially patients, in co-designing governance frameworks, so that to ensure that there is transparency and there is trust. But where does this webinar fit? And this webinar is looking at bridging policy and practice. It's building on the policy brief insights and is spotlighting, hopefully from the countries and from the regions, real-world regional practices and examples. And it seeks to, from the discussion, encourage policy action and to feature perspectives from our experts who have spent many years in these fields and implementing and pushing and designing and developing strong health data governance. In doing all of this, governments and stakeholders must align on ethical AI data use. They must ensure interoperable systems. And of course, above all, it's centered on trust and transparency. So thank you. This will be shared. And of course, as I noted, this will be recorded. So that's from me for now. And what I will do now, I will hand over to Peter Spire, who is going to take over the bulk of this discussion and lead this forward. Thank you all. Peter, over to you. Thank you.
Thank you very much, Ryan, for the great introduction, and welcome also from me to Katja, Luisa, Rachel, and Jerome. I'm looking forward to a very exciting discussion about health data governance. Please feel free to add questions in the Q&A. We will monitor the chat and then see if we can pull in a question that is super relevant to a specific discussion topic. But then we'll try to leave space 10 minutes or so at the end of the webinar to go into these questions and hopefully get some of your most burning questions answered. So to get us started, health data governance in the age of AI. AI is evolving incredibly rapidly and reshapes how we think about data, about decision-making, and of course then about data governance. Ryan and the policy brief just emphasized that AI relies on large, high quality and equitable data sets. And so robust data governance becomes essential. And to kick us off, I was hoping that my 4 panelists each would give us a quick view of how you see AI influencing the broader conversation around health data governance and equitable care. And is it a
Peter, I think we lost you for a second. Your audio seems to be muted. Sorry.
When did you lose me? My apologies. Now we lost you. So I just
last sentence.
Okay, I just said that I wanted to hear from the panelists their view on how AI shapes health data governance. Is it a disruptor? Is it an accelerator? Is it both? And I would like to start with Katja.
Hi, Peter. Thank you and Ryan, thank you for the very good introduction to this indeed very complex topic. In our perspective here in Portugal, what I can testify that I've witnessed firsthand is really AI being actually both, either an accelerator, having in mind the promises that AI systems are making to healthcare delivery, to public health, and to the overall effectiveness of healthcare systems. The potential of these really disruptive tools is really pushing forward the health data governance agenda within ministries. From another perspective, AI also brings very disruptive challenges to current health data governance models. We are talking about the needs for reinforced commitment with data quality and health data governance from an accountability perspective. And so both as an accelerator and as a disruptive agent, AI is really pushing forward our long-standing talk about health data governance in healthcare systems.
Very nicely differentiated answer. And yes, it shines a spotlight on health data governance, which both helps and creates issues. Luisa, how are you thinking about this?
Yes, thank you so much for the invitation, for the context, Peter. And I couldn't agree more with Katja, obviously, and we share the same view. AI is both a disruptor and also an accelerator for the French healthcare landscape. So it has actually helped to reshape health data governance, but also drives innovations that actually democratize access to care, such as AI-enabled remote monitoring solutions, for example. So obviously, as a disruptor, as also other countries here have been confronted with the regulatory overhauls, as AI has pushed many of our national agencies, including the HTA agencies, also to review their doctrine and also to publish guidelines on how to evaluate AI-enabled digital health solutions. So totally new ways of evaluating, but also the concerns that come with bias in AI algorithms. And on the other hand, as an accelerator, lots of opportunities, obviously, on the data accessibility, but also innovation perspective. So we've created already some years ago in 2019 the French Health Data Hub, which enables at the national level to give access actually to health data to fuel actually AI research. But also at the EU level, we've been involved with the French Health Data Hub and the EHDS European Health Data Space pilot, and that enabled secure cross-border sharing to fuel also here AI research. So this has accelerated projects like SHAPED. You might have heard of that EU project that actually seeks to accelerate the development, validation, and integration of AI-driven medical devices in the European healthcare landscape, and that actually works also with real-world evidence and data, and ensures also robust data governance in line with the HDS. And another response in the acceleration, we've supported strongly for the last year's startups, also in their development in line, obviously, in public-private partnerships, also in line with hospitals. The latter have been supported in also creating their data warehouses to make sure that the data is of quality and well organized. And this has been massively funded. And yeah, just to summarize, it's both bringing disruption and acceleration, but we've proven, as you've seen maybe at the AI Summit, also in Paris in February, we're just about to publish our AI in Health roadmap. It's really bringing rather positive outcomes.
Really good points, Luisa, and a flurry of activities. Congrats. That sounds fascinating. You bring up the European health data space, Jerome. From the European Commission perspective, how are you looking at this, and how can you help countries, make sense of AI or of health data governance in the context of AI?
So, good afternoon, everyone, and thank you, Peter, for setting up this call. I think that building on what our panelists have said, I think you can really see AI as the accelerator when it comes to policymaking on our end. There's obviously the AI Act trying to bring a clear framework when it comes to development, validation, and use of AI solutions. But zooming back on health governance, we clearly saw the need for a clearer framework for simply using and reusing our health data, starting with just finding what data exists that may be suitable for development of validation of AI, and then just creating a framework, both technical, but also of a legal and of a governance, to make sure that when data is made available for development of AI solutions or their validation, it is done in a trustworthy way and securely. So that's really what we're trying to do with the EHDS.
Fabulous. And same kind of underlying current. There's certainly a lot more attention on this topic now, and a lot more need for data and data governance. Rachel, how about you?
Yes, and I'll echo. Thank you so much for the opportunity to be here. At the OECD, we published the Health Data Governance Principles back in 2016, and with that, we've been following countries across the OECD, including many in the EU region, on how they're adapting to those principles. And we've seen a great variation, but we've also seen acceleration, just like Jerome was saying, in terms of policy. And countries are really realizing that AI without data is like pipes without water. There's still significant work to do to liberate and better use our data that we already have. I think there's a stat out there that health data represents 30% of the data in the world, and we only use about 5% of that health data for decision making. So there's a lot of work to do in health data governance, but we're really seeing an acceleration through AI and the renewed focus, especially with the European health data space as well, a renewed focus on improving the quality, accessibility, and interoperability of data.
Really, really, really good points. And you bring up an important topic, right? We are generating vast amounts of health data, and we're not reusing most of them. And I think with AI, we have a unique opportunity to dig deeper, whether that's for research or for supporting care decisions. The WHO in this report calls for legal and ethical guardrails to make sure that data that are collected for care can then be ethically reused for AI-driven research without undermining trust. And so I would love to dive a little deeper into kind of how do we think about this from a governance perspective? How do we make sure that all these data that are collected in increasing amounts will be available and can be used in an ethically and privacy-preserving manner? Luisa, do you want to comment on this?
Sure. Actually, it's a huge topic, and I agree. I mean, we should one day be available and also motivated to actually reuse all of the data collected for primary use for secondary purposes. But let me take you 3 years back. Actually, during the French EU presidency, we adopted, together with other member states, the European Ethical Principles for Digital Health that actually provide for a human-centric framework that also guides AI integration and data governance in healthcare. Let me remind you of those 4 principles, those 4 core dimensions. So the first one is to base digital health on humanistic values. One of the actions was listed here to complement always digital health with also face-to-face care, obviously, so that actually enables that trust. Sorry, I just heard someone speaking.
My channel is lost. The channel is lost, unfortunately.
Okay.
Well, the interpreter is saying,
Ryan,
the interpreter is saying the channel is lost. I'm not assigned as an interpreter. Well,
let me double check.
Could please reassign me as an interpreter?
I will do that. No problem.
Unfortunately, there was some interference during the work.
We'll give it a minute until that's reestablished.
Yes, please.
And then Luisa will come back to you.
Sure.
And is it active again? I think it should be good.
Shall we
Apologies
continue?
for the technical challenges. I think we should be good to go. Thanks.
Okay, Luisa, back to you. Sorry for the
Yes,
interruption.
just to sum up again what I said, I took you 3 years back when we actually adopted, together with our EU colleagues, the European Ethical Principles for Digital Health, which we deemed actually a basis for gaining that citizen trust, because we gave them those 16 core principles that actually really ensure that there can be trust also in the data reuse, obviously, because the ideal would be, with all the data masses that Rachel just mentioned, with that being underused, is obviously to close that gap and to be able to use the data collected for care also for secondary use. But let me just drive you through those 4 core dimensions. It's always good to remind yourselves of that. The humanistic values, obviously, we should not replace digital health fully. There's always a necessity to keep a face-to-face solution in care. That's super important. The second is empowerment, enables individuals to manage their own health, digital health, and also data. That refers to the primary use of health data, obviously, and that becomes a reality with patient-enabled tools, where you can actually track what's happening in your healthcare pathway and also opt out if that is your wish. But it's important to give patients that possibility to actually use as they wish their health data, but also to add up and personalize certain things. And that's also what we're making possible in France with Mon Espace Santé. The third one is to make digital health inclusive. That, I guess, speaks to all of us and includes, of course, digital health literacy. And the fourth one is eco-responsible digital health, which is a topic that's unfortunately still a bit neglected. But just to bring you back to those principles that have influenced the EHDS regulation, which, as you know, and Jerome has already spoken about it and will again, but it's about the secure cross-border health data exchange, and also about making and enabling digital health authorities to manage compliance thereof, right? So at the French level, how do we make sure that citizens trust the reuse of health data and actually all the digital solutions that we put in place? Well, I come back to that also later. We organize citizen councils, especially one that we held last year about EHDS, European Health Data Space. And we also twice a year come to French citizens on our digital health roadmap, in which we explain on each of our actions how far have we come and what are the obstacles. And I think that's really key, is that transparency and communication element that we have to keep up in the public, especially when speaking about AI and digital health.
Fascinating. It's great to see, Luisa, how these discussions are already not just national, right? You've mentioned EHDS and the AI framework multiple times. Jerome, do you want to go a little deeper into the EHDS and how are you looking at this across countries in terms of enabling secondary use in a compliant manner?
Thank you. And I think Luis put it very well from the perspective of a member state. I mean, at European level, if we take a step back as to when we were developing the urban health data space, the first conclusion and the first finding was really the diversity in terms of framework when it comes to making it available for reuse. What kind of data was made available, for which purposes, under which conditions, and not always really ensuring the level of privacy that you would expect. So I think there was clearly room for creating a common framework underpinned by common infrastructures to make it possible for simply, in the first stage, empowering specific entities in our member states. Luisa, for example, mentioned the Health Data Hub in France. The idea is that in each country, you could have a very clear, accountable entity in each of our EU member states, responsible and empowered by the European regulation to be able to provide this access. So I think this is the first element of trust. Secondly, was defining a purpose, for which purposes this data will be made available. So really only for purposes that would benefit our people, and nothing that will look detrimental. We even included purposes for which data would never be made available, just to reinforce that point. We want this access to really benefit people in the first place. That's how I think you can get the buy-in from our stakeholders. And then was really to offer a simplified process to find data, regardless of where it is in the EU, no matter the type of data as well, try to be as broad as possible, and then create a common process, common application form, so that if you're looking for accessing data from one country or even more from more than one country, you're able to do it with one application that is then assessed by those agencies. So we're trying to break this simplicity in the process also can speed up the process, and improve the whole thing. And finally, it's all about, when it comes to making this available to users, in our case, we are mandating it to be done in a sequencing environment, so in a secure space where only authorized users have access to this data in an anonymized or pseudonymized format, and non-personal data cannot be extracted. So really trying to bring set of technical and governance measures to really ensure that, yes, people trust in the system, and that really data reaches its potential, which is what we really aim to do here.
Yeah, I completely concur. And I think it's going to help with trust and adoption if we're speaking with one voice and we don't have various approaches and so on. I'm super glad that Luisa actually brought this up, and now you're kind of putting more emphasis on this. How do you see, just a quick follow-up, the implementation across EU member countries? Do you see a similar level of engagement as we just heard from France? Is this kind of is that the normal, or would you say there's still a differences in approaches across countries?
I mean, very quickly, of course, the reality in our countries differ quite extensively. Now, having the HDS principles put in a regulations that clearly states at which stage you should be, or what you should be able to enable by 2029, kind of helps create this momentum. On top of that, we also try to financially support the implementation at member state level of the HDS, and we also created a committee of practice that is trying a space, really, or a community, to bring together entities from the Health Data Hub, like Luisa or any of the counterparts across Europe, to simply share their journey. Where are they when it comes to the implementation of the HDS? They can share tips, they can share their own experience and learn from each other. They were all facing similar challenges, so there was clearly room for a forum that was really dedicated to these purposes. So that's how we try to help to make sure that we are all there by 2029.
Fantastic. A learning ecosystem. I love it. Rachel, OECD is working on a policy framework around AI and health data governance. In this context, can you talk a little bit about the work that you're doing and how that influences EHDS potentially or work in the countries?
Yes, definitely. And I'll actually tie back to the previous question a little bit with other work the OECD is doing, because we did a workshop last year on the legal basis for secondary use of data. We had a key finding saying that we're really relying on consent for secondary use, but that is difficult to scale. So we have a paper coming out in June. So we're really looking into defining public interest, and we see a variation in that space. And this is another example of how OECD work can work in alignment with the European health data space and really support that. But we are working on this AI and health policy specific framework, where we have policies that enable, guardrails that protect, and engagement that can help foster trust. And we have 42 policy questions that policymakers, governments can think about as they're moving forward with AI solutions. And I think these will really help enable the HDS and other initiatives around the world and OECD countries to provide those common guidance on enabling factors to scale AI. And one example, I was in Glasgow last week, and I was speaking to somebody in a member state, and they talked about data protection officers and the role at the top, and you're trying to make decisions. You're trying to bring AI innovations to the market, to the health ecosystem, but you're faced with this dilemma between moving fast with reducing the barrier that you are in approving the solution versus doing no harm and making sure that it is safe, it is secure, you're ensuring privacy of the data. They feel like they're on an island. They're kind of there, but they don't have a community around them to support that decision-making process. And I think the EHDS and these policy frameworks and really clarity, transparency, and cutting down those silos in healthcare can help enable these data protection officers, these people making the decisions about AI solutions, about data governance, to feel less alone. And I think that's where the OECD, the EHDS, and everyone at the table here can work together to try to reduce that loneliness, that space, so that we can move forward and get some clarity in the confusion that is AI in healthcare right now in some instances.
Yeah, I think that's very well put, right? It's not just a technology challenge or a policy challenge. It's also a kind of how do we collaborate? How do we work in a larger system? Katja, in this context, how well do you feel supported? What's your perspective from Portugal? And when we talk about the OECD initiative, EHDS, and others that are helping to set the context and engaging folks from across countries.
Yeah, indeed, we need an alignment, as Rachel was saying, between, and also other colleagues previously, between global and national policies regarding AI and health data governance. From a national perspective, and in our case, our country, for example, the EHDS is really a topic very close to our heart, as we held here in Lisbon the very first workshop where we started as EU to define what the EHDS would be. When we look at global policies, we see a very good coherence on all policies regarding data and AI. So when we look at all of them, we can see that people-centeredness, data protection, responsible innovation, all of those are part of this global policy framework regarding health data and AI. What the EHDS then brings to the table, this newly published European Health Data Space regulation, is the fact that it's not only a regulation, or a piece of paper with principles, it's also an infrastructure. So in that sense, the EHDS will be one of the first real-world test beds for these global policy imperatives regarding how we can actually, as governments, put them forward and implement this trusted system that will enable us to have high quality data sets and to implement AI in a responsible manner. So from a national perspective, this EHDS regulation also supported us, and Portugal is a country that has a national digital health agency from 15 years now within the Ministry of Health. But even so, with a very well-established digital health strategy, the data governance model, a clear data governance model, was still lacking. So EHDS will actually support us with the adequate and concrete measures that we will take to make sure that we can, from one side, develop a national data governance model that is aligned with our European values. But from the other side, the EHDS also brought this unique perspective of cross-border health data sharing and national sovereignty. So much of the discussion that it's specific to the EHDS regulation as opposed to national policy on data governance was the need for us to discuss how we will build up this system that will enable us to exchange data cross-border and really tackle regional public health issues, be better, improve the resilience of our healthcare systems, and make Europe better prepared for next public health crisis. So in that sense, I think that we have this very good alignment at least at the EU level, between global imperatives for health data policy and our regional regulation. And now we are really at this very interesting stage of putting it into practice and make it work for the benefit of our healthcare systems and of health as national and European good.
Excellent. I think all of you now mentioned kind of data flows, even cross-border data flows. And I think oftentimes even within countries, the data aren't flowing that well, right? The interoperability, a long-cited and long worked on topic still is lacking in many instances. What is your take on kind of what are the key barriers and what are priorities to make these flows happen? I see we get the policy frameworks and the collaboration in place. What other barriers do you see that we could help address to improve data flows within and across countries? Luisa, do you wanna comment on that?
Sure. So you mentioned also beforehand that interoperability, good interoperability comes before AI. And so what we've done in France, that's obviously an essential principle, but we've adopted our second roadmap already for digital health. The current one is for 2023 to 2027. And we've obviously lots of priorities and objectives here as well. But this is one of them. And we have a digital health agency. So it's our operational arm here at the Ministry of Health. So that's an agency of 200 people. And they actually work on interoperability frameworks and across electronic health records, but also health information systems. And that allows actually the seamless data flow between hospitals, clinics, healthcare providers, which have more of a private kind of function in France. But there's an overall strategy that was actually co-funded by the European Union, actually, as a result of the COVID pandemic with a fund of 2 billion actually back then. So that was really a massive leap forward. We call this program Ségur Numérique. So it's basically a national program really enhancing the data flows between those actors, but also thanks to that agency that we've set up for a long time now, but without which we couldn't be operational. At the EU level as well, we're very active for many years now, but now all of us, many of our speakers here also are involved in this joint action called XTEHR, which sets the European data exchange format, which I think is also the basis for implementing the EHDS from the primary side at least. And on AI readiness, on the question you asked, I think one of the key necessities and principles is also the training aspect. No need to go very much in depth here. We're all aware of this and that we're not ready to face the AI, what AI will bring to us and to our healthcare providers. So what we've done in France is that since actually this academic year, all healthcare professionals in their first year of training, in their first years of training actually, will have an AI component and will be trained for that. And also there will be AI-specific education tools for more advanced healthcare professionals. Yeah, just as a response to one of the so many actions we can take. Many of them actually sit in this document I mentioned to you that was published in the during the AI Summit. It's a state-of-the-art AI and health document, what we've done in France, and you can have a look at it.
Thank you, Luisa. I do want to kind of keep this comment on kind of how do we get physicians familiarized with AI, I think, into the kind of trust discussion that I want to touch on in a couple of minutes. Before we do this, maybe let's also look at frameworks and interoperability beyond EU. And maybe, Rachel, you can talk about this a little bit from an OECD perspective and just kind of seeing what barriers you see maybe beyond what Luisa just mentioned.
Yes, definitely. I've actually had the unique opportunity over the last 5 months to interview over 30 experts in the space, including standards organizations and governments on interoperability. So we're going to be doing a workshop in the new year or at the end of the year, and then hopefully publishing something before the new year on this. But some initial findings we found is that just like the policy brief mentioned, we need to build standards and we need to promote interoperability. But at the end of the day, this is a people problem, not a technical problem, not a semantic problem. We need strategies. We need people to come together and align on standards to reach cross-border initiatives, reach ability to share. But that is bringing people together. So I think we lose sometimes the people that really could be change agents in this space that are really into change management. There's one example from Australia that I'll bring up. They have the Sparks AU initiative right now, and they're really, it's kind of a fire accelerator, the terminology standard, also on a foundation of open air, which is another common terminology standard, but they've created a sense of, they use the word FOMO. They wanted people to feel like they wanted to be there. They wanted to be a part of this community, the vendors, the patients, providers, everyone's at the table defining what common standards are. And I think that is the key, is it's a change management problem. It's not necessarily a technical semantics, just like Louisa mentioned in France. You have great standards, you have great interoperability established on a national level. So we know how to do it. It's just facilitating and supporting it to happen. And I think a big part of that is also incentives and the balance between the carrot and the stick, the incentives versus the penalties and the repercussions if you don't do it. Some countries have shown a great example of this, particularly in Denmark, where since the 1970s, they've had a foundation of trust and transparency, but that also comes with, you need to meet our standard specifications to bring your technology into our ecosystem. So if we have a foundation of incentivizing the adoption across the different stakeholders in the space, there's the great potential to work together towards interoperability. And technology advances over 10 years, we're going to have a new set of technology in the ecosystem. So if we start now with the European Health Data Space and other initiatives like the International Patient Summary of setting common standards, saying you need to meet these specifications to work in our health ecosystem, both nationally and cross-border, then we can reach that thing that we've been searching for a long time of an interoperable cross-border health data sharing system.
Very well put. Thank you, Rachel. You mentioned Australia, and there was a question in the chat which indicates there's a perception that in the US and Asia and some other areas in the world, we're progressing faster than the EU. There's more talking and not as much doing. Maybe a quick open question to all of you. Is that the case? Where do you feel we could potentially accelerate or also learn from other regions to accelerate health data governance, but also then usability of data for AI? Anyone want to venture an answer?
I think that's very complicated. I think there's many facets to that, the balance between precaution or safety versus, you see different models in different countries. In the US, there may be a little bit more voice towards innovation when the European Union moves towards protection and ensuring safety and protection of health data. And it's finding that balance, the do no harm versus move fast and break things. And we're really at a pinnacle point of choosing the direction. And some countries have chosen the move fast over the do no harm and finding it for their culture, for their ecosystem, what works best for their building that trust and transparency in the solutions. And I think it's really a by country, by culture, by what the current legislation and the model of the country versus federated or unitary country model. It really depends.
Excellent. Yes, I would completely agree, Rachel. Thank you. Let's change topic a little bit and go into the trust discussion. So we were discussing about kind of trust in health data through better health data governance. We brought up, I think Luisa brought up trust in AI, right? And AI governance, as well as how do healthcare workers operate with AI, and how in the end do we make sure that patients, caregivers, physicians, and others are kind of comfortable in working with AI. There was a question also in the chat, and to Jerome actually. Do we plan in the EU approaches to kind of validate AI models or test them, and have an approach again that's across EU versus within individual countries? This goes a little beyond the pure health data governance, but I think it's an interesting question to look at governance of AI models in addition to the underlying health data governance. Would you comment on that?
So in our case, we, as part of the European data space at least, we were trying to see how those new bodies we're setting up, the health data access bodies, can support the development and validation of AI with existing infrastructures. This development is already happening. We know that, and we already assessed the important need for accessing large amounts of data, high quality data. So it's something we can bring to the table. EHDS at least can facilitate access to this data, but it needs to interplay with what's already existing. If you look at some of our initiatives like the AI factories, that was launched by the European Commission, so these excellent centers really supporting developers with having access to the right tools, the compute power that you need to be able to do this work. That's what we are exploring for the project Shaped, and perhaps Luis, since you are involved, you can expand on this if you see the need to. But that's where we're really trying to see, through the EHDS at least, how can this be enabled? So mainly focusing on the part on accessing the data that is required for developing and validating those models.
Yeah, makes sense, Jerome. Luisa, do you want to look at this from the country perspective?
On the health data governance, on the citizen on the citizen trust. Sorry,
on the trust overall, kind of citizen trust,
sure,
but then
sure,
also
sure.
service providers.
Indeed. Thank you, Peter. Sorry about the misunderstanding. So indeed, the trust topic and citizen involvement topic is one of our most important and most favorite topics at the Digital Health Delegation in France. Why? Because we've been for years now setting up citizen committees, actually, when we have crucial and controversial questions, we come to the citizens, and we have a very specific way of working with them. They actually chosen arbitrarily, so randomly out of the general public. So it's not just I would say the educated with citizens with a master's degree and or PhD who can then let us know what they think. No, it's actually anyone who interacts in those citizen committees. And we did a one on the EHDS regulation, so on health data governance last year, actually over 3 weekends. There were 30 citizens, actually from very diverse backgrounds and regions and educational backgrounds. And they deliberated on the challenges and opportunities represented by the EHDS. And they actually provided us with 52 recommendations, and we were stunned by their level of the way they gotten deep into the topic and actually made recommendations, mainly targeting at improving transparency of health data use, but also ensuring that patients have actually effective control over their health data. But they also targeted at the need to balance health data innovation with robust protection and also individual rights and privacy. And they also focused a lot on accountability, but also the need to keep still a quite flexible governance model between countries. So that was quite impressive. And what we do at the Digital Health Delegation is we take those 52 recommendations very seriously, since now what we're doing is we prepare a national law actually to implement the EHDS. We know it's a regulation, so it's implemented as such, but still our national law still needs some adaptations. And we will look very closely at those recommendations. And also, if we do not pursue those recommendations, we will also let citizens know in a very transparent way why we could not follow those recommendations. And we also have organized consultations, national consultations for the EHDS adoption law, for the law to come. First, more from inner circle, which is more agencies and institutions. And the second circle also included the private sector, included healthcare professionals. Any type of sector was included here to really make sure that this is going to be a swift progress. And yes, so just in a summary, it's really lying close to our intentions to make digital health inclusive and that everyone is getting interested in it.
Very cool. And very insightful. And I think you framed it right, saying, there's national preferences that you really need to pay attention to. And I think important to then think as we kind of streamline things across an EU and beyond, to combine, what national preferences exist and enable kind of specific solutions in the different countries. We're almost out of time, and I want to make sure that we do touch on a few of the questions that maybe didn't fit exactly into the flow from the audience. So I'll hand over to Ryan in a couple of minutes to maybe just highlight 1 or 2 questions from the chat. But before we do this, I really appreciate your open and constructive input in this discussion and really enjoy the commentary. I'd love for you to give the audience 1 piece of advice each. So the WH policy briefs, as Ryan outlined, mentions 4 urgent actions needed on the health data governance space in the age of AI. 1, strengthening national governance to improve care and trust. 2, building robust data standards for interoperability. 3, coordinating across data providers for consistency. And 4, engaging stakeholders to ensure inclusive ethical frameworks. I would love to, if you could just highlight what's the most important piece for you, or is there something that you find just as important that you would just share with the audience as a parting gift, let's say, before we then open up for audience questions. Rachel, do you want to go first?
Definitely. I think the brief is great. I think national governance is definitely the place to start, but we also need to think about building towards cross-border governance. And like we've talked about here with the European Health Data Space and other initiatives. And then the other piece I'll mention related to interoperability, but other things, is incentives. How do we incentivize the adoption of these standards? How do we incentivize the use of the governance? Because you can have your best plan, you can put money behind it, but if people don't adopt it, you're where you started. So incentives are key.
I completely concur. Jerome?
No, I think for me, you all of the elements you highlighted are essential. I wouldn't pick on one, but what I would say is really trying to build on what is being done. That is, what's done in the EU, we have a framework, we have a regulation, so this is already ongoing. But I would like to highlight, for example, a collaboration we have with WHO Europe that aims to promote some of the standards and the principle of the European data space across the European region, so really beyond the EU and across European regions, because we think, we're not reinventing the wheel. That is, some of the principles we've been discussing now, trust, this access to data that is done with a strong governance, secure access. So these are all principles I think really that are accepted and I think ought to be integrated in frameworks anywhere. So that's why we try to, at least at our scale, that is across the European region, to just promote those and thanking WHO Europe for supporting us with these efforts.
Fantastic. I love that you emphasize, even though you're looking from a European Union perspective already across a large number of countries, you're thinking even wider than this, across the European region. I think absolutely essential to collaborate broadly on this. Excellent. Katja, how about you?
Yes, indeed, I agree with Luisa and Jerome on the fact that all these policy imperatives put forward by WHO are extremely relevant in our current health policy landscape regarding data. I would only add one that I think it's also horizontal to all of those, that it's actually capacity building for responsible innovation. So today we are facing healthcare systems that are requested to implement AI, and we have public health institutions, we have clinicians, we have citizens that really need to be empowered to deploy AI solutions in their local environments. So this is about empowering public health institutions, healthcare institutions, into knowing how to select and deploy AI models, how to have and to build the adequate data ecosystem for AI models to work, and also to manage the complex issues of data sharing between public and private sector in this very mixed field of digital health and technology. So this is a core challenge that we as health systems are facing today. And also we as governments, the better we can navigate this challenge to make sure we can find this right balance, as Rachel was saying, between innovation, but also ensure that we are not concentrating power and reinforcing existing gaps, ensuring that digital solutions will not benefit only resource-rich settings, communities, or countries. It's our fundamental challenge to make sure that we really shape what AI will do, and not only rely in what it can do, but be really active in creating this AI-enabled environment for health and care.
Yeah, absolutely right. Very good. Last and certainly not least, Luisa.
Yes, obviously I agree with all of the statements of the brilliant panelists here. I fully agree also with what Katja just brought up on the making public and private collaboration much more of a reality. I think we have spoken a lot about the European digital health market, but it's not fully a reality yet, and it also applies to data access. I think the European health data space will actually fuel that and make that a reality on the data access, but then also comes the support of companies actually to stay on European soil. And I'm not just speaking here about the EU per se, but also beyond all of the European region, which is now covered by the Europe region. So it's super important to keep those companies, obviously to support them, explaining them the regulation, which by some are considered extremely strict, but also to help guide them and give them financial support so that we can thrive together as a Europe of digital health. And obviously, just to underpin again those WHO principles, which are all fully important, and starting with interoperability, and then obviously all of the other aspects are important, including the citizen participation that I mentioned beforehand, and the training and empowerment that was also mentioned by Katja, and all with by using incentives, as Rachel said so well. Thank you so much.
Well summarized, Luisa, and thank you very much for really, really good advice that supports but also complements and helps the policy brief. Ryan, I think we have time for a couple of questions if you want to pull out one or two from the chat.
Great. Thank you so much, Peter, and thank you so much to our wonderful panelists. And I think, honestly, you have answered some of the questions from the audience, but I will try to pull out a few. So there's a couple that I think are related. Somebody's asking, what should data governance frameworks contain? Ethical considerations, consent mechanisms. Health data is very complex, and should you think health data governance should be for whole being for whole health data is enormous. So should they work on specific frameworks of different facets, such as mental health, etc.? And related to that also is, somebody's pretty much asking closely to the same thing. Will national data governance models or frameworks be developed to be specific to health, or should they also go across sectors?
Peter, I don't know if you want us to jump in.
No, Brad, jump in when you're ready. Yes.
In any of
Thanks,
the
Katja.
questions, because yes, actually, this is a very relevant question, and it goes, in my perspective, really to the core of our discussion here. That is how we are thinking about health data governance mechanism. Should we still think about sectoral health data governance, look at it on a disease perspective, on a health determinants perspective, or should we review how we define health data, how health data is generated today, and rethink our governance mechanism for data? Even though it may really seem like an enormous task, as Ryan was pointing out, to look at the entire realm of health data, but health data today is generated passively. It's generated by wearables, by smartwatches. Not only, it's not closed within the borders of healthcare institution as some years ago. So in my perspective, I really think that we need to review our perspective regarding the definition of health data and the governance model that we will be building to ensure that we'll be able to reuse this data every time that it's needed for the different objectives that we might have, either in a public health surveillance perspective, disease research, or any other uses that are currently needed within our healthcare systems.
Thank you, Katja. Any other comments on this, or?
Yes, I would like to comment on the intersectoral use of data, not just health data, but combining it with other data sources, obviously in line with One Health, with the One Health approach. So one day, hopefully, we can also use data from animal health and also environmental health and combine those data sets, but maybe even beyond that, maybe look also into social data and into data that really give us a 360-degree perspective on the health trajectory, which is obviously not just linked to pathogens, but many more factors. So my summary would here be, and something maybe before I summarize, the One Health approach is just to give you the example of what we do in France. We have created a Green Data for Health project that actually already links environmental health data with health data. So that's actually going in this One Health direction. Yeah. So we need to make sure that the data spaces, and Jérôme, maybe you have a few thoughts on that as part of the digital decade. I guess health is the first data space that's been created, but there will be more data spaces. Hopefully it will go in this direction of not only One Health, but also having this 360-degree vision of our healthcare trajectory.
Thank you, Louise. And now you rightly point out that the European data space is one of the data spaces that have been proposed by the European Commission. So the idea is that for several other sectors, think of culture, agriculture, environment, obviously, the need to leverage data to develop new solutions to just support decision making is there as well. Now they have different challenges. We're not looking at the same type of data. That's kind of what motivated us to start German data space with the regulations. Health data is sensitive, not to say that other types of data don't have different kind of sensibility. They might be commercially sensitive, but because we were looking at a very, very sensitive type of data, it's our, it touches our health. It is quite so personal that we thought there was a need for a clear first legal framework, and then creating the processes that we've been discussing up to now. Now, it doesn't reduce the value of really linking data from different types of sectors. You talked about health and environment, but equally you can think of health and financial data. How could health data also influence financial decision making for us, or financial aspects are definitely linked to our health status and our condition. So we are just creating the framework to make sure that at the very least, the different data spaces are linked through various data, the dataset catalog. So when you are looking for data, you would be able to look for health data, but also other relevant data sets in the different fields, so that you have this visibility on, when you have a specific research questions that may require data from multiple sectors, you have these references with those data spaces from different sectors. That's how we see the link with other, how what we're doing at least is relevant for other sectors.
Thank you so much, Jerome, and thank you to the speakers. And unfortunately, we're out of time. So, Peter, I'd like to thank you very much for leading this discussion and being a wonderful moderator. And to our speakers, Jerome, Katja, Louise, Rachel, thank you so much for this. It's been a quite interesting discussion that I'm sure we can take this on for hours. But thank you for this. Just to note, just the key highlights that, the EHDS is a good underpinning for EU, but also spread across the entire WHO 53 member states region. It's also important. And a lot of the messaging you give is important, such as ensuring that there's strong governance, ensuring there's transparency, of course, ensuring that there's proper literacy behind this, both for our healthcare workers, policymakers, and our population. And I think Rachel quite nicely summed it up. I really like that, AI without data is like pipes without water. And underpinning data means that we need to have good data governance to ensure that we're collecting proper data, quality data, clean data, and all in a transparent mechanism, so that we can actually build on and use this data in an ethical manner and a sustainable manner for AI moving forward. Again, thank you so much for all of this. It's been a wonderful past hour. So again, thank you, and I bid you all farewell and have a good rest of the day.